2 weeks ago, we came to you from the same location. I'm at the Taifa Polyclinic. We started a conversation on men's health. We wanted to touch, because Father's Day is just coming up, we thought we would dedicate every Thursday to men so that we can talk about something really pressing. We started off with infertility. We didn't quite finish. So we're back here at the Taifa Polyclinic to the man in charge of the facility, who is also our doctor for these segments this month. Dr. Charles Dewhurst is hosting us again in his compound. Good morning to you. We're grateful. Yeah, so we talked about infertility, but there were so many questions that came through, we couldn't quite finish the conversation. So can you just a little recap of the whole subject, and then we can get into the questions that some people asked.
Right. Last, I think 2 weeks, we
Yes.
talked about male infertility. And we are saying that it's actually when the male has a problem with fathering a child. Usually we can say that after a whole year of unprotected sexual intercourse without results. Now, there are some common causes for these. Mainly we have the structural causes, and then we said that commonly is some dilated veins just on top of the testes. Okay, we call it the varicocele. When there's this collection of veins being dilated, it can cause infertility in most people. In some situations, you also have the testes not descended. Usually after birth, the testes should have descended, but if it's still within the body, there's a lot of damage to the testes, and that can lead to infertility when the male child grows up.
Okay.
And then we talked about STIs commonly. Okay, that's sexually transmitted infections. Now these causes some blockage, okay, in the flow of the sperms for them to come out to cause fertilization. Rarely you can have some hormonal causes. In the first place, the testis doesn't produce any sperms at all. Okay, but it's rare, just in about 3% of cases.
Okay.
And then we also have autoimmune causes where the body itself is destroying the sperms. Okay, because it sees it as foreign. Most often you do all the evaluation and everything is normal.
Yeah.
So up to about 25% of men, they don't have any structural problems, but still you do the sperm count and it's low. Okay, so we call them idiopathic. We don't know the cause, but still they have an issue with infertility. Yeah, so these are the common causes. Yeah.
I remember we talked about how you do the tests.
Yes.
And then the issue about masturbation came. But people also had questions of their own. Somebody asked, for instance, that they masturbate, and could that also affect them, their fertility sometime in the future?
Yes, if you remember, we said masturbation alone gives a different appearance to the sperms, more of a traumatic appearance. So that means the process of masturbation, in quotes, is not natural. So that alone is not advisable. That is, if you are looking for a child. More of it to eventually reduce the quality of sperm in terms of the number, etc. Because even with the sample that we take for analysis, we usually say that you should be off sex for about 2 to 5 days. So when you engage in masturbation often, it actually reduces that quality of sperms.
Okay.
And if the quality is not there, you cannot fertilize an egg.
Okay.
Now I must add that it's not only masturbation that can give us the sample for analysis. There's also coitus interruptus, where the two partners usually, they will be in their own room, okay, engaging in sexual intercourse. So just before the climax of sexual activity, the male withdraws, okay, and then the sperm goes into the container for us, okay. The last method is the use of condoms, okay. We collect the sperms in condoms. Just that we must make sure that these condoms do not contain chemicals that will destroy the sperms. Yes. So masturbation itself is not advisable if you have issues of fertility. Yeah, you want to really father a child you should look at it.
Okay.
Yes, and stop masturbation.
So most of this would be more of delayed parenting. It's not like you can have a child at all. Are these issues something that can quickly be resolved?
Yes, that's a good question, because you need a lot of patience. Now, as I said, we do a thorough evaluation, and that includes the history, physical examination, and then some tests. So during that period, you have to really be patient so that we get to the bottom of it. Yes, that's why we give a whole year of unprotected sexual intercourse for us to suspect a problem of infertility. Usually, if you are more than 30 years, because of the age factor, we reduce it to about 6 months. 6 months of unprotected sexual intercourse, then we want to find out why you're not having a child. Because as you are growing old, the quality of the sperms also reduces a bit. Yes, so after 30 years, we intervene a bit earlier, as opposed to less than 30 years, where we can give you up to about a year of unprotected sexual intercourse. If you're not having conception, then we find out the cause.
Okay.
Yes.
But do we always have a successful end?
Not always.
Okay.
So in such cases, there are other options like artificial reproductive techniques or assisted reproductive techniques. And just like we would have done in a female, what we do is that we try to fertilize the egg outside of the womb. So the one that is fertilized, then we go and place it in the womb for it to grow to become a fetus.
Okay.
Okay, so there are options. For example, we have intrauterine insemination, and then we have in vitro fertilization, just as we do for the female. If we are not making headway with treating the male, we also look for that options. Yes.
But there are times that you have to look at a man's face and tell them that it simply can't happen.
Oh yes. Oh yes. So in those situations, maybe we'll look at adoption. Okay. Yeah. Those situations are there. But most of the times, if we are patient and we look for the cause, we make some gains, some headway.
I don't know, but the men that you've come across, have they been patient enough to go through the process?
In the first place, most of the times, the ladies come in alone. So when they come in, we tell them that, no, when it comes to fertility, it's a couple affair. We have to look at the two of you. I think the fear is that as a male coming to see a doctor, for us to tell you that, okay, well, the problem is from you. You can't father a child. It's very frustrating for most males. So thinking about that possibility, most of them will not even step up at all to come and see you. Yeah. So in a few cases, we do a lot of thorough evaluation of the female. If still we are not finding the cause of the infertility as respect to the female, then we convince them to bring their husbands. Sometimes it works out, sometimes it doesn't.
Okay.
Then they'll just leave you and look for other alternatives because they think they're not making headway. But it's because the male is not getting involved or the man is not getting involved. Yes.
All right, it's an all men's conversation on this Thursday on the AM show. We call it the Healthy Thursday Conversation, and because Farmers Day is just coming up, we decided that the whole month the conversation will be about men, and it's a conversation that we started 2 weeks ago that we're continuing. But just like it happened 2 weeks ago, there were questions around the subject, and somebody's asking a similar question. Gabriel in Ho says, is premature ejaculation a disease?
Okay. So we can look at premature ejaculation from two angles. Okay. We have psychogenic. When we say psychogenic, it means it's from the brain. It's psychological factors. And then you can have organic or pathological causes. Now, the difference is that, most of the times, usually at dawn, you expect the male to have some erection, nocturnal erections, okay. If you're having those erections, then most likely everything is normal.
Okay.
Okay. So when it comes to premature ejaculation, you want to find out that is it that the male cannot psychologically control himself, because the whole stimulation for ejaculation comes from the mind. So if you have a bit of control on the whole activity, you're able to reduce the excitement a bit. Most of the times, you're able to delay the ejaculation. Okay. Now, the female can also help. Okay, we have the squeeze and pulse method. What happens is that just before the male ejaculates, the female will just hold the penis, try to squeeze it and stop it. Okay, so it's like I'm controlling your excitement a bit, then stop. So after some time, yeah, it helps to control the premature ejaculation.
Okay, all right. This is almost like a very deep conversation.
Yeah.
On this particular subject.
Yes.
So let's. Is there more to share? Or?
Yes, and then some will also talk about Kegel exercise. Now, how you do that is anytime you have the urge to pee, you control it. Okay, so if you have the urge to pee, as soon as you go to the washroom, before your first, just control it a bit. Okay, for some few seconds before you let it go. Now, when you are doing that, you are actually strengthening the pelvic muscle. There are some muscles down there that control this whole ejaculation thing. Okay, so if you strengthen them enough, sometimes it gives you more control over the whole ejaculation thing. Yes. So most of it is psychological. Yes. And usually the first sexual intercourse, the male is likely to ejaculate much faster. With subsequent ones, the time reduces.
Because now they kind of know what it feels like.
Exactly. So usually when they come as couples and then they are not married, I just tell them that, hey guys, I'm sure when you get married, these things will solve. Because with marriage, there's the control there. You're not in a hurry, all of that. So usually those problems of premature ejaculation reduces. So these are the psychological factors. Sometimes there are actually issues, okay, that we have to investigate. Is there a problem with the nerves? Is there diabetes? What do we have to look for? Is there a problem with the BP, etc.? But most of it is psychological. That after some counseling, you'll be able to deal with the problem.
Okay. Yeah. We encourage you to send us your questions or your comments via regular text or SMS with the number on your screens. And Zach from WA says, Doctor, anytime I play sex, my sperm doesn't come. Okay, and please, when you call, you just disrupt the reading of the message on time, but it takes about 5 minutes before I can ejaculate, but the sperms come very small and my wife complains.
Okay. Now, I think 5 minutes, 5 minutes is not bad. On the average, that would be good for most men. Okay. With respect to the volume of sperm, last week we said that between 2 to 5 milliliters, that's very small, just about, the ejaculate for most men will be about half a teaspoon. And that contains the adequate numbers of sperm to be able to fertilize an egg. So you can't just look subjectively at the volume and say that it's small, so there's a problem. Unless we really check it at the lab, etc., to know that, okay, this volume doesn't contain enough sperms to fertilize an egg.
Okay.
Yes, other than just by that. And I think the other common question we get is sometimes the sperms, after the whole sexual intercourse, the woman gets up and the whole of the sperms comes out. So they say, oh, why? Is it not going inside to do the job? But we should remember that it's just one sperm that is going to fertilize the egg. You don't need a whole lot. Yes, so that in most cases is not a problem.
Okay.
Yes.
Okay. All right. Danny from Insawam, I'm acknowledging the message that you've sent to us. We will get back to you. This one says, good morning. Can you ask, is masturbation, if masturbation is same as coitus interruptus? I think you've given the difference, right?
Yes.
Yes, you've given the difference. I don't want us to go into details on that. It's very early in the morning. Sumani in Tamil, is there any negative effects in the practice of this method, as in the removal method? I'm not sure there's anything, right?
No.
This one says, I was masturbating for 6 years now I have stopped, but I still doubt if I can reproduce. Okay,
so you can only doubt if you can reproduce when we've done some checks and then we found a problem. Okay, he can't just conclude that because he masturbated, so he's infertile. Okay. Masturbation has its own issues. For example, it causes a lot of trauma to the penis. Okay, they end up developing some scars, etc. Because you are forcing, it's an unnatural way to stimulate yourself. Yeah, sometimes they can even end up with a penile fracture.
Okay, there's a question just coincidentally, somebody's asking whether masturbation causes pain in the penis.
Okay, yeah, so just as I was saying, you cause a lot of trauma because you are forcing the body to ejaculate through an unnatural means. Okay, so you have to, so most people will probably, spend so many time in the bathroom or wherever, trying to stimulate themselves. And that friction alone causes a lot of injury to the penis. Sometimes they do that against objects, okay, pillows, etc. And if the penis is erect and accidentally you hit it hard against the object, it can actually lead to a fracture of the penis, and you need a repair. You go to theater to try and fix the penis back.
Wow.
Yes. So masturbation has its own issues. So
I'm thinking that maybe we should dedicate our next session to it, because even on this we have lots of that.
Questions,
This one says, how long can a man masturbate in his life, which can cause infertility? There's no formula.
No, there's no formula. Yes,
it's
just
not healthy.
And everybody is different. So the mere fact that somebody did it several times and has no issue, you just do it just a short time and probably will give you problems. So,
okay. There's a technical question from Baden. Baden says, is it self-masturbation or cross-masturbation that affects sperms? I don't know that.
Okay. Right. I guess the cross masturbation means probably is your partner that is stimulating you to that. Yes.
Okay.
So I'm talking about the self masturbation. Yes, that's what at least research have found that it causes some changes in the quality of the sperm. Yeah.
All right. Nana Kweku Nelson is in Cape Coast, and he's asking, if you release so fast and after the first run you find it difficult to erect, is it also a problem about infertility?
So usually after the first round, there's a period we call refractory period. So it's kind of at the time that the body tries to recover from the first one. Okay, so on the average, at least 30 minutes or more.
Okay.
Yes, so definitely there will be some time that you do whatever you do, the penis will not erect because it's in that refractory period. Okay, so if it recovers, then you can stimulate again to the penis erects.
Okay.
Yeah.
And the rest of the questions is on masturbation. Yeah.
Okay.
Evans says, if one masturbates for a longer period, how long would he have to stay off masturbation for him to get back in his right shape? I wonder what that means.
Yes. Okay, I'll take it from this angle. Usually, we don't want, just as I said, 2 to 5 days. Okay. We know that time is enough for the body to recover, for you to get a good quality of sperm to fertilize an egg. Yes. So probably about a week would do. Yes, but as we were saying, if it's chronic, if it's something that has been going on, for it has other changes it has caused in the body. So it's not just about staying off the masturbation that will help you with your fertility.
Okay.
Yeah. If the other changes in the body that has occurred because of masturbation, then we have to look at that as well.
Okay. Yeah. This one says, anytime I look at a female, I get erected. I want to know whether that's also a disease.
Okay. We have different forms of sexual disorders that most of them through psychological counseling you'll be able to help the clients out. Okay. It is not usual or ordinary for you to see every female and then you get an erection. So probably there's something going on that you have to see a psychologist to counsel you. There are different forms of the sexual disorders. Sometimes there are some forms of sexual disorders that the patient or the person will have to, the person moves in a crowd and tries to just rub himself against any female. Maybe you go to Makola, etc. Just rub yourself against, and that's how he gets satisfied. Okay. Sometimes the person will go naked, okay, and then will just be hiding at a certain corner. As soon as a female sees him in his nakedness, then he gets his sexual satisfaction. Yeah. So there are different forms of sexual disorders, of which provide appropriate intervention.
Okay.
Most of it is through psychology.
I guess our next conversation then is on sexual disorders in men, if that's fine. Okay. But the Eric Inchefo Piasso says, I've been masturbating for the past 2 years. Is it likely I won't give birth? But I guess maybe we can conclude with this. How do people stop it? Is it so difficult?
Yes, it's an addiction. Okay, just as you get addicted to tobacco, alcohol, etc. So it's not easy. That's why you need an expert to help you.
Okay.
Yes, because most of the time, if you try to do it on your own, there's a high incidence that you relapse. Okay, you go back to the habits. Yes, so it's an addiction that you need an expert to help you to stop it.
Is telling your partner helpful in any way? Opening up to your partner, would it be helpful?
I think so, because in all this, if even you bring in an expert, you will need to involve your partner to help you stop it. Just as maybe alcohol, for example. When you are trying to stop it, you have to bring in the family sometimes, because they have to keep an eye on you.
Okay.
Sometimes it's because the males or the men want to please their partners that they engage in masturbation, because the belief is that when you masturbate, okay, when you stimulate yourself, you ejaculate. So that when you meet your partner, it takes a longer time for you to ejaculate. So you don't have an issue of premature ejaculation then. Yeah, so most people, before they they have a sexual intercourse with their partners, they go into the bathroom, and then that's the males, then they ejaculate, they masturbate to ejaculation. So that before they engage in the natural process with their partners. And that one, they don't get the problem of premature ejaculation.
Because they've already
yes, exactly, the earlier one. Yeah. So in that case, you have to, your partner has to be involved, or your wife has to be involved, so that you know that, okay, after all, it's because of you that I'm doing this. Okay. So that I sit down and talk about the whole issue of premature ejaculation, that, okay, this is how to go about it. You don't need to go and hide and masturbate before we have our natural means.
Okay.
Yes, so you have to involve the partner.
Okay, so we have to end today's conversation here, but from next week, I think we will have 2 weeks to talk about the sexual disorders in men. We're absolutely grateful. There are so many questions of how to get in touch with you. There are thousands of people who want your contact right now, but I can say that you are the medical officer in charge of the Taifa Polyclinic, and you're available to see anybody who walks in. Okay, Dr. Charles Dewhurst, thank you so much for your time this morning.